Today in this video we'll discuss about gout and its therapeutic management. Gout is a painful form of arthritis caused by high uric acid levels in your blood, a condition known as hyperuricemia. When uric acid level rise, sharp monosodium urate crystals form and accumulate in your joint and surrounding tissue, triggering sudden and intense pain. The big toe, also known as podagra, is the most commonly affected joint. But gout can also strike the ankles, knees, wrist, finger, and even elbows, making everyday movement painful and difficult. Fun fact, did you know that the gout affects 1 in 25 adults worldwide? It is especially common in men over 40 years and the post-menopausal women due to hormonal changes that impact uric acid levels. Did you know gout isn't a joint pain? It's linked to a serious health condition like metabolic syndrome, cardiovascular disease, and kidney function. Managing gout isn't just about relieving pain, it's about protecting overall health. So, what are the best ways to manage and prevent gout? Stay tuned as we break down the top treatment option and lifestyle changes to keep gout under control. Don't forget to like and subscribe for more health insight. The gout progresses in 4 distinct stages. Understanding these stages is the key for early detection, treatment, and prevention of complications. Stage 1, asymptomatic hyperuricemia. In this stage, the uric acid levels are elevated above 420 micromoles per liter in men and 360 micromoles per liter in women, but there are no noticeable symptoms. Treatment is not required at this stage. Only lifestyle modification like staying hydrated, maintaining a healthy diet, and limiting alcohol can help to prevent progression. Stage 2, acute gout flare. Stage 2 is when the things get painful. This is an acute gout flare. Flare-ups happen suddenly, often at night and with intense pain, redness, swelling, and heat in the affected joint, usually in the big toe. The triggers include alcohol, purine-rich diet or food articles, dehydration, and certain medications like diuretics and aspirin. Without treatment, flare-ups can last anywhere from 3 to 10 days. Early treatment is crucial to reduce pain and inflammation quickly. Stage 3, intercritical gout. After an attack subsides, there's a silent period called intercritical gout. No symptom may be present, but without treatment, gout attacks become more frequent, more severe, and involves multiple joints. This is the best time to take action. The goal here is to prevent reoccurrence and maintain healthy uric acid levels. Stage 4, chronic tophaceous gout. If gout is left uncontrolled, it advances to chronic tophaceous gout, the most severe stage. Uric acid deposit called tophi forms in joints and causing permanent damage, deformities, and chronic pain. At this stage, there are also a high risk of kidney stones and chronic kidney disease. Urate lowering therapy is essential to prevent further damages. Did you know that the gout is not only about uric acid, but patient weight, diet, lifestyle also play a huge role in managing and preventing flare-ups. The first step is weight management. Obesity, especially BMI over 30, is the major risk factor for gout. The more excess weight patient has, higher the chance of uric acid levels. Losing weight can reduce serum urate levels by 18% and significantly decreases gout attack. So here we have to advise patient about healthy weight management by engaging in regular physical activity, but avoiding crash diets. Sudden weight loss can also actually trigger gout flare. Second is dietary modification. What you eat matters. Certain food can increase uric acid levels, while other can help to prevent gout attack. First is to limit purine-rich food. Purines are a natural compound that break down into uric acid. Too much can trigger painful gout flare-ups. So here We have to advise patient to avoid high purine foods like organ meats, seafood and red meat to keep uric acid level in check. Second is to reduce fructose and sugary beverages. Fructose is another hidden culprit. High fructose corn syrup in soft drinks and processed foods increase uric acid production. So, we have to advise patient to cut down sugary drinks and opt for water and unsweetened beverages instead. Third is to limit alcohol consumption. Alcohol, especially beer and spirits, block uric acid excretion, making gout worse. Recommended alcohol intake for men is less than equal to 2 drinks per day, and for women it is less than equal to 1 drink per day. If patient is getting a frequent flare-ups, then avoiding alcohol is the best option. Lastly is hydration and smoking cessation. Staying hydrated is one of the simplest way to manage gout. Aim is here to drink at least 2 to 3 liters of water daily to flush out excess uric acid. Smoking increases inflammation and oxidative stress, making gout even worse. Hence, quit smoking can improve overall health plus reduction in gout attack. So, we can say that small changes in patient diet, lifestyle can make a huge difference in preventing and managing gout. Now, let's discuss about pharmacological treatment. For acute gout flare treatment, it is a short-term relief. The main goal of treatment is simple: stop the pain and reduce inflammation as quickly as possible. Here, the first line treatment is NSAIDs, non-steroidal anti-inflammatory drug, are the first choice for treating gout flare. They work by reducing swelling and inflammation in the affected joints. Dose is naproxen 500 mg twice a day, ibuprofen 800 mg 3 times in a day, and indomethacin 50 mg 3 times in a day. NSAID can cause side effects like stomach irritation, kidney damage, and increased heart risk, especially in older adults. Second is colchicine for severe attacks. Colchicine is specialized gout medication that blocks the inflammatory pathway to prevent crystal-induced swelling. Dose is 1.2 mg at first and then 0.6 mg 1 hour later. Maximum is 1.8 mg per day. Colchicine works best within first 36 hours of flare-up, so taking it early is crucial. Side effects are like diarrhea, nausea, and stomach cramps, so it can be taken with food to prevent the side effects. Third is corticosteroids used for severe cases. If NSAIDs and colchicine are not suitable, then corticosteroids like prednisone or methylprednisolone can help to control inflammation. Prednisone dose is 30 to 40 mg per day for 5 days. This medication are especially useful for patients who cannot tolerate NSAIDs due to kidney issues or bleeding risk. However, steroid can cause mood swings, weight gain, and high blood sugar, so they should be used cautiously. Gout is more than just a painful flares. It's a chronic condition that requires long-term uric acid control. The goal is to keep uric acid levels below 360 micromoles per liter to prevent future attacks and joint damage. And remember, never stop uric acid lowering therapy during gout attack. Stopping suddenly can actually make flare worse. Long-term medication for uric acid control. There are 3 main types of medication. First is Xanthine oxidase inhibitor. It's a first-line treatment. Example, Allopurinol and febuxostat. This medication works by blocking uric acid production, making them first-line choice for preventing gout. Allopurinol is most commonly used. It works by lowering uric acid production. Starting dose of allopurinol is 100 mg per day and can increase up to 300 to 600 mg per day. Common side effect is mild rash. It's rare but serious. It's known as hypersensitivity syndrome. Watch for severe rash or liver issues. Second drug is febuxostat. It's an alternative to allopurinol intolerance. Dose is 40 to 80 mg per day. Warning is it may increase cardiovascular risk, so it should be avoided in heart disease patient. Second category of drug is uricosuric. It increases uric acid excretion. Unlike xanthine oxidase inhibitor, uricosuric drug like probenecid work by helping kidney to remove excess of uric acid. So patient with good kidney function can safely excrete uric acid, but it cannot be used in patient with kidney disease or kidney stones. Third category of drug is pegloticase. It is used for severe treatment resistance gout. For severe chronic gout that does not respond to other treatment, pegloticase offers another option. It is an IV enzyme therapy which converts uric acid into harmless substance. So used only in severe treatment resistance cases. Now let's discuss about urate lowering therapy ULT in gout management. As you all know that gout isn't just about painful flare-ups, it's also a long-term metabolic disorder caused by excess uric acid. Over time, crystals build up in the joints and tissues, leading to severe inflammation, joint damage, and kidney complication. That's why urate lowering therapy or ULT plays a key role in gout management. It helps to prevent future flares and protects your joint and kidneys. When ULT should be used? So according to 2020 ACR guideline, ULT is recommended for the patient with any of this condition: presence of one or more than one subcutaneous tophi, radiographic joint damage due to gout, frequent gout attack, that is 2 or more than 2 flare-up per year, history of 1 or more previous gout flare even if infrequent, moderate to severe chronic kidney disease, CKD stage 3 or more, serum uric acid level greater than 535 micromoles per liter even without symptoms. And last is urolithiasis, uric acid kidney stones. So now, when is ULT not recommended? In some cases, it's not recommended. First time gout flare. Once flare doesn't always mean long-term gout. Doctor usually wait before prescribing ULT. Another point is asymptomatic hyperuricemia, where ULT is not recommended. If no symptoms are present, there are no urgent need for medication, only lifestyle changes may be enough. Now, let's discuss about preventing flares during ULT initiation. So, starting urate lowering therapy is a crucial step in managing gout long term. But here's something that many people don't realize, that beginning ULT can temporarily increase the risk of gout flares. Why? Because as uric acid level drops, crystals dissolve and shift, triggering an inflammatory response. But this can be prevented. So first line prophylaxis to prevent gout flares is colchicine. It's a first choice medication to prevent flares. It's a powerful anti-inflammatory that helps to stabilize your joints during this transition. Recommended dose is 0.6 mg twice a day for 3 months, or if needed, 0.6 mg once a day can be used for milder cases. But be aware, colchicine isn't for everyone. It can interact with certain medications and should be avoided in patients with kidney or liver disease. Colchicine can be dangerous if taken with CYP3A4 inhibitors or P-glycoprotein inhibitors. This increases colchicine level in body, leading to a toxicity. So make sure we have to avoid colchicine if patient is taking clarithromycin. It's a strong CYP3A4 inhibitor. Certain antifungals, example ketoconazole, HIV protease inhibitor, and patient with severe renal and hepatic impairment. So now, alternative prophylaxis is NSAIDs. It's non-steroidal anti-inflammatory drug. Example, naproxen. If colchicine isn't an option, then NSAID can be used. Recommended dose is naproxen 250 mg twice a day. But remember, NSAIDs aren't suitable for everyone. If you have a history of stomach ulcer, kidney disease or heart problem, then it's not a best choice. The last resort is low-dose corticosteroid. If both colchicine and NSAIDs are not tolerated, a low-dose corticosteroid may be used. Recommended dose is prednisone less than 10 mg per day. Since steroid can cause overweight, or I can say weight gain, mood changes and blood sugar spike, they are usually only used when no other options are available. For best result, prophylaxis should be continued for 3 to 6 months after starting ULT. This gives your body time to adjust and reduce the risk of painful flare-ups. So once the uric acid levels are stable and within the target, the risk of flare significantly drops, and then we can safely stop prophylactic treatment. Next, we'll discuss about chronic tophaceous gout, its risk and management. Gout isn't just an occasional pain. It can become chronic and severely damaging if left untreated. This advanced stage is known as chronic tophaceous gout, where hard uric acid deposit called tophi form in joints, tendons, and even in soft tissues. Chronic tophaceous gout develops after years of high uric acid level. There are several risk factors like high serum urate, that is greater than 535 micromoles per liter, frequent untreated flares, chronic kidney disease, and skipping or stopping urate lowering therapy. Over a time, tophi, a chalky uric acid deposit, can form in various areas like joints of hands, feet, knee, elbows, tendons of Achilles and fingers, and can be even develop in ears and subcutaneous tissues. If untreated, tophi can lead to severe joint damage, deformities, and disability. There are several ways to manage this tophi formation. So the key of managing chronic gout is long-term urate lowering therapy to keep uric acid level below 360 micromoles per liter and prevent new tophi formation. So as you know that urate lowering therapy is the cornerstone of the treatment. There are two options. First line option is allopurinol. It starts with 100 mg per day dose, can be increased to 300 to 600 mg per day. Second is febuxostat. It's an alternative for those who cannot tolerate allopurinol, and febuxostat dose is 40 to 80 mg per day. And second point is how we can prevent flares while starting ULT. So we already discussed about colchicine, NSAIDs and prednisone. Third, do tophi go away? Yes, with consistent ULT therapy, with strict uric acid control, tophi does not just stop growing, they can actually shrink and disappear over the time. However, if gout remain uncontrolled for years, tophi can cause permanent joint destruction, sometimes require surgery to remove them. We'll discuss about long-term benefits of ULT. As we discussed earlier, ULT helps to reduce flares, but some studies shows that it can take up to 1 year to see benefits, not within first 6 months. So, it's not advisable for patient to stop the medication if flare still happens early on. Maintaining low uric acid levels leads to a long-term improvement, which includes fewer or no gout attack. Second is shrinkage of tophi. Third is lowering joint damage and preserving mobility. On top of this, there are some extra health benefits. First is lower down the blood pressure, protects the kidneys, and third is to reduce heart attack. So there are some studies which shows that using allopurinol over 180 days may lower down heart attack risk in elderly patient and black patient. This means that sticking with ULT long term isn't just good for joints, it may protect heart as well as kidneys. Thank you for watching. We hope this video helped you to understand gout and its management better. If you found this information useful, don't forget to like, share and subscribe to our channel for more health insights. Stay connected with us for more updates. Let's keep learning and stay healthy together.